Good morning. Today we will discuss about a quite an uncommon condition, and a lot of my patients come to see me after they've seen many other specialists. The condition we're going to talk about is called thoracic outlet syndrome. So the first thing is to explain what thoracic outlet is. The thoracic outlet is a narrow area that is formed by the first rib and the clavicle and the collarbone. In this narrow area, which can be, narrow because of trauma or even because congenital development, there are some structure that go to the arm, and they are from front to back: a vein, an artery, a nerve. So when these structures are compressed, patients tend to experience a range of symptoms. So they can have a blue end when the vein is compressed. They can have a very pale end when the artery is compressed, or they can complain of paresthesia or pins and needles down the finger. How do we diagnose thoracic outlet? It's quite simple. So we tend to do a dynamic angio-MRI, so a magnetic resonance imaging, which is done with the arm down and up. And normally we can see that with the arm up, the blood vessel tend to be pinched. So we are able to recreate the symptoms and have an objective description of it. And then we do nerve conduction study. So where we measure the speed at which the stimulus is carried down the nerve to the arm and the finger. So if there is a delay in the transmission, then we can diagnosticate the level at which the problem is occurring. How do we fix this problem? Well, most patients tend to require an operation, and the operation is aimed at relieving the compression. Now, if you imagine this space like there is a floor and the roof, we cannot take the roof out because we cannot take the collarbone out, but we can take the floor out, and that's what we do. We remove the first rib, and also we detach sometimes the scalene muscles. These are muscles that are attached from the first rib and they go into the neck. Occasionally we will have to repair the blood vessel or even remove the scar tissue from around the structure. Often it is necessary a multidisciplinary equipment involving a nerve specialist and a vascular surgeon to address very complex cases. Normally the relief of the symptoms is very good, and patient can go back pretty quickly to their normal activity. The incision tend to be done either under the clavicle or above the clavicle or under the axilla, according to the structure that are involved. If you want to know more, or if you're experiencing these symptoms, please get in touch with us and we will try to help.